Eric.
Live stream setting.
All right. So, Derek, we are going to let everyone in and we'll let you kick us off.
There goes show Caitlin.
Funny.
Good morning. Welcome. As we wind down our, I am muted and I'm just talking away. Um, to say good morning and welcome. And thank you for joining us. I know everybody has, this is a very busy time of year and calendars are filling up. Either that or, you're home with sick ones or you're sick yourself because I've seen that space too. So I just appreciate that you have given us at least an hour of your time this morning. And I am going to pass this off to, well, first of all, for any of you who are new or joining, I'm Melissa Schoenberger. I am the section director for childcare licensing that focuses in on field services and system work. We do have a co-directorship within childcare licensing at KDHE, and that is Jarvis Dolman, who focuses in on operations. He has a prior commitment. Childcare licensing is a very robust, um, big operational program, and he is meeting and has other obligations this morning and will be joining us later on. But that being said, I wanted to introduce Derek Flurlog, who is our Bureau Director in the Bureau of Family Health and where childcare licensing lives as a program. And he would like to address our systems improvement team and say a few words. Derek?
Yeah, thanks, Melissa. Hey, good morning, everybody. I know we're up against the holidays, and so kind of hard to focus on some things right now, I would say. So appreciate everyone hopping on and joining us. And it seems like, I mean, between my kids and we've got like multiple people sick on the team, and just it's that time of year, I suppose. So I just really appreciate everyone's time. I'm only going to be on for about the first 5 to 10 minutes this morning. I have another exciting meeting with another state to talk about some cool things that are going on. And I realize that's a bit of a teaser, but I'll just leave it at that. Always exploring innovative ideas. So I did want to bring up, I know last week United We had a webinar where they discussed a report and they had some recommendations that were centered around child care and child care licensing. And so I wanted to just let everyone on the SIT team be aware that we were aware of the report. Several months ago, we had the opportunity to meet with the author of that report and I think kind of clear up some misunderstandings and maybe misconceptions about how childcare and childcare licensing works in Kansas. And so that was a really good opportunity for us to do a little bit of education, but then also hear from them around the things that they were finding and reading and sort of hearing. And so it's always good to see reports and see reviews of the system and the work, whether it's in Kansas or other states or even other countries for that matter. We're always trying to dive deep into that stuff. So with that, I would just say if anyone comes across those things, definitely feel free to send them to us. We love reading. We love being aware of kind of what's out there. I know Megan and the KU team do a great job of that as well, sharing things with us or we share things with them. And so just wanted to put that out there too. In the actual report itself, so there's a few things mentioned, um, and I didn't open it in front of me to look at it, but I remember a couple of the recommendations are things that we are actually already doing and we've already implemented. The one thing that comes to mind is expanding fingerprinting access and utilizing public libraries. That's something that's been ongoing for, gosh, well over a year now at least. Dawn Brown, who leads our background check and fingerprint unit, they've been traveling the state, and whether it's libraries or other settings, they've been able to go into those all across the state and make it a public engagement setting. Of course, They've also done some trainings for directors and other staff, home providers now as well. So we are really working hard to expand access to that sort of thing. Of course, fingerprinting and background checks are federal rules and requirements. So it's sort of our job at the state. Of course, we have to be compliant with that as a state, but then it's our job to um, make access, more equitable across the state too, both for rural providers and providers that live in larger communities alike. So a little bit different strategies for how we can do that across the state. There's different partnerships, and we're always exploring that. So just wanted to mention that if you all read that report and come across things, or if anything piques an idea, definitely let us know. If you're like me and you're on your drive to work or drive home, or in the shower or something, and you come up with this great idea, like send it off to us. It doesn't have to be a fully fleshed out idea. You don't have to have an entire strategy around it. If you have something that you just want to share, let us know. It can be through the SIT team here. You can send an email separately. We are pretty informal, Melissa, I would say, in the way that we take ideas and brainstorm on things with folks. So, and we can always come back to the SIT team as a way to flesh that out as well. So I think that's a great way to sort of use this system. The last thing I'll mention is I do have a meeting with Wendy Doyle, who is the CEO of United We. Have not met her before, and nor have we had any conversation, but reached out to her a couple weeks ago and said, "Hey, you've got some recommendations for us. Let's talk. We want to hear what you all have learned so that we can improve." So, um, just another, I think, example, I guess I would say, of us needing to be willing to put ourselves out there and hear the feedback. And if there are ways we can change or improve, then we're going to do that. And if there's reasons that we can't do that, whether it's federal rule or infrastructure issues or whatever, like we'll be honest about that, and we can again utilize you all as our systems improvement team to sit down and flesh out and talk through those reasons why. And so Megan, maybe this is an opportunity in a future SIT meeting to more thoroughly go over the United We report, or to go over some of those recommendations. I've asked Allison Dalrymple, who's our Deputy Bureau Director. She's also our director for our admin and policy team. She does the regulation work, writes the regulations, and kind of does all of the lovely work that it takes to get those going through the process. I've asked her to work with the team, Melissa and Jarvis, myself. Jennifer, you're going to be in that too, Jennifer Manuel, and many other people on the team, to sort of look at those recommendations and come up with a response of sorts, which I think we could share with our systems improvement team. That way, everybody has a better idea of the things that maybe we are doing, the things we aren't doing, and why, and sort of go from there. So I think that's all I've got, Melissa and Megan, unless anybody has any quick questions or points. That's my time.
Thank
I
you,
just
Derek.
wanted to,
Oh,
oh,
sorry.
can I add to Derek's
Please.
list? Because we do, Jarvis is in here, and background checks falls under his purview within operations. And we did receive a sneak peek of a report created by Don Brown. Kansas had eclipsed their 5-year requirements, so meaning all of our providers are required every 5 years to be fingerprinted. And we came up to that threshold. And I just have to give it a shout out, because in addition to our normal work, just our normal, we have new facilities opening up, new affiliates added, and background checks. Don's team processed almost 10,000 extra affiliates this year, on top within that 5-year requirement. And she went out and beat the pavement, went to communities, trained program directors, and really provided community with resources. And it's not a glamorous aspect of the work. It's a very redundant component, data entry, putting in, monitoring how everybody's there. But it is such a critical piece to support the early childhood field. And quantifies the professionalism because we look at a background check, and it ensures parents and guardians while they are, away from their children, that children are in safe spaces with adults who have passed that. So I cannot say enough about Dawn's team and what they've done over this last year, which when we were meeting last winter to discuss the onset of that process seemed very daunting. And now, as we're coming up on a full year, just so proud of the work of Dawn. And I know if Jarvis was present, he would be sharing the same component. So just really wanted to give a shout out to Dawn, because really their work supports all of us within childcare licensing.
And I'll add to that too. Sorry, Megan, as you go off unmute and I start talking again. Last thing I'll say. Um, one of the questions we had when we started doing the 5-year renewals was, are we going to come up against people that are unwilling to do them, or do them in a timely manner? And we were conversing back and forth with the feds about compliance with that and how we needed to address that. And I don't have the data directly in front of me, but the far majority of providers on the list are like, I was just blown away, like 90+% had zero issues with getting them in a timely manner in terms of us having to potentially take a monitoring or enforcement action. And so, those are things we don't want to do. And so we were glad that again, the far majority we have not had to. And when you're talking about tens of thousands of people and you say 90+%, that's a lot of people that are doing what needs to be done on all fronts, and that includes our team as well. So again, maybe that's data we can share at a later time too, in a later meeting for you all to see. Just coming up with ideas as we go, Megan. So
Great. Thank you. Thank you, Derek and Melissa. We will send the report out with the notes. I apologize for not being able to do that live. We have it as a file and not a link, so that does not work super well with Zoom. So for anybody who hasn't seen it, stay tuned. It will be coming shortly. All right, so I'm going to go backwards real quickly. So that was our early childhood system updates. We'll do member updates here in a minute. And then the rest of the meeting we want to spend, we're going to do like a really quick high level overview of the All In for Kansas Kids strategic plan, just to make sure that everyone knows that there's a updated version of that available. And just so you can see kind of how childcare and our work on the systems improvement team fits within that plan. And then we'll talk about the regional roundtables, which we held the first one in November, and want to hear some feedback on what was shared from that group, as well as talking about the next two that are planned. So I'm actually going to scoot us ahead on the slides. Are there any member bright spots or updates that you want to share? But another.
I'm gonna pick on somebody, Megan, and see if
Please.
Dana wants to share about her adventure as a part of the her innovation team.
Well, I was contemplating whether or not I should say something, Melissa. So I got to take part in a really great couple of days. I was part of a group from Kansas that traveled to Massachusetts, and we went to Harvard University and participated in a 1 day. And it wasn't a conference, but more like a training. And we had a plan that we were it's hard to explain what we did. We went through a process. How do I even explain that, Melissa? Where we were looking at developing a kind of a community level plan for childcare. And there's some funding related with that, and how we will roll it out, and how we will more specifically get communities ready for that process. And it was really, I'm having a hard time explaining it, probably because I can't decide on which part I like the best. But it was really great to be with other states and communities around the country to see what they were doing and to see what we could do in our state to make that happen. And it was just really powerful. And at some point, we need to write up a report on what we did. But it was great being able to have access to some of those higher level facilitation skills. You know, we joked about I had imposter syndrome the whole time I was on the campus at Harvard, but getting to see how other communities and other states are addressing childcare was really a neat experience. So that was great. I did not do that. I didn't do it justice, Melissa, but it was a great experience.
I think you did great, Dana, and we'll put an asterisk on that and say more to come.
More to come. It was really great.
Thanks, Dana. Any other updates or bright spots? All right. Okay, well, again, I'm gonna do like a 5-minute, really high level overview of the All In for Kansas Kids strategic plan. I imagine some of you have heard this pitch several times now. Amanda, you're on my screen, so I imagine this is super familiar to you. But we just want to make sure that everyone is aware of it as a resource and also that you know, you kind of see your work. Amanda, did you raise your hand?
I was just saying it to, how did I raise my hand? I didn't mean to. I was just saying, Megan, this sparks joy. Go for it.
Please. Okay. So the All In for Kansas Kids strategic plan, we had a version of it came out in 2020. This is like kind of the next iteration of it. And so it was finalized a few months ago, earlier this year. But this is it was approved by the Kansas Children's Cabinet, and it is really following the process we went through in 2019 and 2020. We did an updated early childhood needs assessment, and then used that to directly inform the new strategic plan. So it is available online, and I'm going to actually look to my colleagues, Clayton or Bree, if you wouldn't mind dropping the link in. That would be great. It's available on the Children's Cabinet website. It's also available on the All In for Kansas Kids website. If you would like a hard copy, let me know or someone on our team know, and we can mail those to you. I know some people have been wanting them to share with their teams and just make sure that they have a copy handy. Ria, did you raise your hand? Zoom is raising hands today, so if anybody wants to share, please jump right in. Might have a little extra attendee somehow in Zoom. Okay. This is a lengthy document, so again, I'm not going to do it justice. It is, let's see, 51 pages. So I'm not going to walk through all 51 pages, but just want to make sure you kind of understand the layout. It is split into 3 key pillars. And so throughout, you know, the early childhood system is massive. And so it's really looking at workforce, kind of the ecosystem, which is the kind of the governance and just all the different like structural parts of the system. And then of course, like how are children and families actually experiencing the early childhood system? And then as you go through it, and we're going to show you some examples, there's the pillars, and then within those, there's goals and actual action steps. And so these are really designed to be like a roadmap for the next 5 or so years. There's not technically an end date on this strategic plan, but we know the work is in many cases already midway through. We're building on efforts that have been going on for years, and in some cases may take longer than 5 years. But it's really designed for anybody in the system to kind of say, what is the vision for the system over the next 5 years, and how are we going to achieve it? So here's an example, Pillar 1, Goal 3, and you can see, I mean, again, you can read it and see all of the different actions and goals specifically, but we wanted to show an example, and really the purpose today is we want you to see how often childcare is mentioned in this. The strategic plan is representative of the entire early childhood system, so certainly beyond childcare, but it is a major theme throughout. So we pulled out as many places as we could find language around childcare, and we're not going to walk through this entirely, but the reason we're doing this is A, we want you to see how your work both with the SIT as well as just in your other roles like is reflected in the plan. And my hope would be that every single one of you, as you read the strategic plan, feel like, oh, that's exactly where we fit in. In November, several of our state and system leaders came together to do an exercise of just that, of actually like going through and literally like pulling out pieces of paper with, you know what, this is my work is represented in this specific action. And it was the goal was to build awareness of the plan, but also like we all should be reflected in this work. And these are like kind of actions that maybe be happening at the state level, maybe happening at the local level. And if there's anything on here that you're saying, oh, I'm doing that at the local level, or I want to do that at the local level, that's great. Like there are not assignments written next to any of these specifically. Some make sense for certain organizations, but it's really designed to be a roadmap for anyone in Kansas invested in early childhood to make progress. So again, I'm not going to walk through all of these, but there's, I think, pretty broad reference to childcare from things like public-private partnerships, strengthening relationships with employers. How does subsidy play a role in childcare? How does childcare licensing play a role? How do we make childcare affordable for families? How do we support our workforce and make sure that they are compensated well, that they are valued, that they have the adequate trainings? And then how do we like kind of strengthen how childcare connects with other services as well? Oops, sorry. So that was a super high level process, or excuse me, super high level overview. If you have not read the strategic plan or at least glanced at it, like would highly recommend that you do. And again, if you want a physical copy, just let me know and we can get that mailed out. Melissa, is there anything else you want to share? Because I know you've thought about how to kind of embed this in your work.
What I wanted to share is that I appreciate what you said. This is not specific this is Kansas's plan. And so it is not specific to one agency, one program. What I envision as we look at this plan, because there was that little blip in the last plan with COVID. And so things did not quite go in the map as intended. But we still did a lot of amazing things. And I really look at this strategic plan as a reset and moving that work forward. And what I would like to see with the systems improvement team so that everybody feels invested in this, similar to an exercise that I participated in, is really looking at the plan and then seeing what work you've done and investments you've made even at the local level within your agency or personally to that align with any of these, because I feel really passionate that when you see yourself in this plan in your work, then that's when that strategic plan really moves forward at a statewide level. All work, is Dana, to reiterate what Dana said, starts locally. And I think we learned that, especially in Kansas, that when you see movement and a charge forward in an initiative, it's because of not a state agency saying, hey, we need to take this on. It's really because somebody locally has made that charge and moved that forward, which has always been a pride, I think, in our state. And so we'll continue to look at the strategic plan and really want to see what investments that you've made, and collect those. And that's really and share with the Children's Cabinet and all invested parties, just so that there's, again, that robust support of the state plan. Because every time I look at it, I know I geek out a little bit and I get excited. So I agree with Amanda. I cannot see it enough because I'm like, oh, we've done this. Oh, I see this moving forward. And I think that's what makes a really good strategic plan, is you can identify yourself in that plan. So we'll continue to revisit this on top of everything that we do, just because I think it's important that we just don't, because it's a great book, but I don't want it to sit on your bookshelf and collect dust. We really should be seeing how we move it forward, because one day someone's going to be asking, like, how did we do here? What are our stories to tell that we've moved that dial? And so I see the systems improvement team under the early childhood governance adding to that.
Thank you, Melissa. I appreciate that. And yeah, exactly. I think you nailed it when you said like this is probably many of us have seen those strategic plans that are a whole bunch of work and they look really beautiful. And then you're like, what happened to that? And that is like,
Yes.
nobody wants that with this plan. We want this to be living. I was just looking at my physical copy and like noticing how it's already like very bent and damaged. And like, that's a good sign. We want to see some really worn out strategic plans over the next few years, and there is work underway too to track progress. I think for me, I appreciate this strategic plan as an anchor because there are days that this work feels really overwhelming and like how are we going to tackle these big complex problems? And I find it to be kind of comforting to see a plan to see, you know what, there's all these other people doing work across the system and it's systems work is slow moving and it can be painful at times, and to be able to see where we are having wins at the state and local level, I think is important. So more to come, both on just like if you need to get familiar with the plan, but also just know that we're working on how we're going to communicate progress so that you can see how things are kind of getting checked off as we go. Are there any questions about the strategic plan?
I do encourage everybody to get a copy, though.
And Clayton dropped the link in for the digital version as well. Okay, so we're going to switch gears a little bit here. The regional roundtables. So we hosted the first regional roundtable in November. It was in Abilene, so the North Central region. About 30 people attended. I think the majority were quite a few childcare providers, which was wonderful. And we had what I would say was a bit surprising, strong representation from the school district. So Amanda and anybody else connected to K-12, like your people very much showed up. So that was exciting. I think it was nice to hear the level of interest from local schools. So we're going to share kind of the key highlights that came out of that, and we want to then like turn the conversation to you to say what's standing out as something maybe that the systems improvement team can explore. So as a reminder, our cadence is going to be every other month we'll host a regional roundtable. And then the following month we'll come back and say, here's what we heard in that region of Kansas, and where are there places that we feel like childcare licensing can make recommendations, could take on some work. I think both in scaling, like if there are things that are working really well, like why is that working so well? And is there a way to like continue to expand that? And then where are there opportunities to improve? So we asked attendees in a survey ahead of the session and during the session, what's going well, what's not going well, or what are the challenges, and then how can the state support you? And as a reminder, some of this is very specific to childcare licensing. Some of this is kind of bigger, like other agencies or bigger, like state system level challenges. And so KDHE has really owned like being a liaison for sharing that information with other organizations. So don't feel like this is all problems for childcare licensing or this group to solve, but we know that childcare crosses agencies, and so we want to share back what we're hearing locally. So common themes we heard about what's working well in North Central Kansas. We heard a lot about people feeling really good about their relationships with childcare licensing, with the licensing specialists, feeling supported, feeling like they knew where to call. Health and safety grants specifically were called out as a valuable resource. Training opportunities, I think that was a little bit more broad, but people felt pretty equipped to get the training needs that or felt like the training needs that they have are being met. And then also just local networking, I mean, and local collaboration. So that all very, very encouraging. What are the challenges? I don't think that any of these are going to be a surprise to anyone here. I think this is probably not really specific to North Central Kansas, though there might be some nuances. Workforce, not enough people, not enough money to pay them. I think consistency and quality of care. And we talk a lot about like, how are we defining quality? And like, that is going to mean something a little bit different in different parts of the state and even provider to provider. But making sure that all local families have access to quality care and providers feel like they're able to provide quality care. And then the lack of public value. I think somebody specifically said, there's still a lot of the like babysitting commentary. So again, nothing particularly surprising, but affirming. And then how can the state better support childcare in your community? And these are really, I'd say, the slides that were like, where do you see opportunities for this group to make some change? Recognizing training from other states, making qualifications more friendly to finding substitute providers. I think somebody specifically, and Melissa, jump in since you were actually in the room if you remember any of this differently. Making sure that it's a little bit or like trying to figure out a way to be a little bit easier of a process for people to be able to bring in substitute care, and making sure that they're like meeting quality standards and meeting licensing standards, but in a way that there aren't barriers for actually finding that and onboarding that provider.
And what a rare opportunity we had, because we were in Abilene. We were actually hosted at a child care center, which was fun. Let's, go on site, right, to where care is being provided. But we were hosted by Robin Hansen, who is a huge advocate for substitute care, and actually monitors a substitute pool across the state. And so it was a really unexpected opportunity for her to hear in that trust and the onboarding, because it's really easy to possibly move a center staff, because it's more business oriented because it's a separate building. But when you start discussing home provider, there's a reluctance to have somebody who is unfamiliar, because you're inviting that person into your home. Even though it's a business, you're inviting them into a very personal space. And so really discussing some of those nuances of what we could do to overcome some of those challenges. Because again, it feels very different when you have a substitute come into your home versus somebody going into a child care center.
Thanks, Melissa. Again, we had strong representation from the school districts. I think we had a couple superintendents in the room, and so who are really interested in childcare, and I think trying to figure out like how to strengthen collaboration with people that know childcare really well, and how can the school district be partners. And I think that can mean a lot of different things, like how to understand licensing, how to understand that K-12 and early childhood spaces are just different. Training for staff is different. And I feel like this is, I think this topic has been pretty popular over the past several months. And so I was personally excited to see this one, and imagine this group might have some good ideas on how to provide some resources around that. Faster background checks, I think Melissa just talked about, like there is work underway to try to improve that. More online support for childcare providers. Melissa, I don't know if you were like, that one was not, do you remember kind of any of the details on that?
I think it's really, when childcare providers are free to communicate, it's not during childcare hours. So it's really looking at what support systems we can have that align with when they have they're not caring for kids, it's not like, oh, I can take a 15-minute call to get some technical assistance or even 30 minutes because I'm still responsible for the little people in my care. And so really looking at support systems that they can access at their availability versus, a traditional 8 to 5 sort of context.
Well, and I think that fits with the next one of, we heard before, like some people feeling like there really is a good amount of training resources available. Also, we're talking a very rural part of the state. And so that might be if you're in this one pocket, that feels true. If you're in a different pocket, you're not feeling like things are available close to you, that you're having to travel more. So I think also the online support speaks to that and just acknowledging the geographic challenges. And then we also heard just continued support for shared services and the retention bonuses that had been previously available. So I'm going to stop there and see if the group has just any reactions to what was shared or any thoughts on areas that feel like something you'd like to explore more.
What I would like to share is really quick is we I mean, I see Jarvis has joined us. We could have talked another hour or two. I mean, we really, I was at first like, oh, we just have 4 open-ended questions. This can be done in 30 minutes. No, no, no. The group, they had a lot to share. They were honest, which is what we wanted, and professional. Really enjoyed the conversation the around the school district and the childcare settings, and had some program directors who were very vocal that the childcare setting is not a K through 12 setting. It is different and why it should be honored that way. But did not mean that they still were not implementing a curriculum and that they were still not meeting with parents and having those conversations and want it to be honored in such a way, but respected that it is different. And so that was a really good conversation. But again, we really we could have stayed with everybody for at least another hour and filled the whole content, if not more. Is there anything out of the 4 areas that you feel like we could reframe the questions? Or if you feel like we're still on target with the questions that we have, anything that was an aha moment that you may not have suspected that you maybe want us out of the 4 areas that we shared with today that we can maybe craft and be more pointed asking at our next session. And I'm going to quit talking and throw it back to the SIT team.
I think your comment that you made that you could have continued the conversation for longer, I mean, leads credibility to that you're asking the right questions. So I'm so sad I meant to go, but then I had something come up. So, but obviously, yeah, if you had lots of conversation, it sounds like you're asking the right questions. So I would say go forward with what you're doing.
Thank you, Dana.
It also sounds like really terrific work was done to make sure that the people in the room were good, right? That there were enough people from the area and from different backgrounds that it lent itself really well to a good conversation. And I think that a little bit gets it. We're more organized as a system than we were several years ago. It's easier for us to say, okay, we want to put this out, and so we have some communications channels available to us so that we can really spread the word. And it's not that there was this great conversation and then 2 or 3 weeks later, people are saying, oh, I had no idea that was happening and I really wanted to be there. So I think that's good inspiration for all of us to keep up the work in terms of promoting these when they're available, to really encourage the different people who we have in our own spheres of influence to get to these conversations so that they can make connections and be part of the discussion.
I would agree with you, Amanda. I mean, the network that we didn't have a whole long time frame to get this out. And the folks that showed up at the table were so diverse. It wasn't just childcare heavy. Again, we had a superintendent, we had some families, we had providers, we had licensing specialists. I mean, it was just a really diverse group of folks interested in childcare, and I am just was overwhelmed with the response and who came to the table and how many just showed up cold. We asked for pre-register, but they just showed up cold, and and that was great. And yes, Rachel dropped into the chat that we'd like to see some more home providers. That's always our target. Rachel, even when we have trainings, we really shoot for home providers. So we are scheduled again in January, and that will be that we can make a pointed target of them. And we appreciate the SIP members who showed up and volunteered, because Rachel was very kind to do our registration and sat at the table. And so she got to meet everybody and provide that additional context of who was missing at the table. So we couldn't have done this without our SIT team.
And I think, Rachel, I think that's a good note for us of like, we want to keep doing better with each one of these. It was our first one. I think it felt very successful, but I think,
Yeah.
I think family childcare providers, and I think just more families as well in general
Exactly.
are very much, we want help promoting that so that we're having both providers and consumers of the service, and really anybody who's interested, showing up at our next ones.
Melissa, you were there and you have your hand up.
Sorry, I was gonna type into the chat, but I'm on my phone today because my sub canceled. And we're outside. So just quickly, Rudy, I saw that you mentioned about the Spanish speaking courses. I will say that in Abilene, I don't feel like that is as big of a need. But if you were in those southwestern parts of the state, sorry, I have a friend fighting over a truck. Hey, Otto, please wait. Thank you. Every time I unmute, there's another truck right there. Anyways, in that southwest part of the state, I know that there is that need. And I say that because when I did the CCPC conference last year, that was one of the big things that was on our evaluations, is that they just don't have that access to those Spanish speaking courses in person though. So I know that's a big thing. But I feel like everything else went well.
I would echo what Melissa said, and definitely we're going to take that as a additional comment, because one of the pieces as a system, I'm just going to kind of go off script here. Kansas in 2025 will be launching our workforce registry, otherwise known as CAPE. And one of the pieces that we don't have a really good full picture of is what we're lacking in our training in areas. And so CAPE will give us a centralized location where all of our trainings will live, and we will be able to note specifically some of your questions, Rudy. And then as a system, we can make recommendations to where we have training gaps. Right now, we make educated guesses, and most of the part we're pretty spot on. But it'll be nice to have the data and really be able to understand where our training gaps are, because it just won't be training from what we think traditionally like CCSIT, child care aware, child starts, family conservancy, CCA of Eastern Kansas. KDHE transitioned in November 180 unique training organizations to the system, where they will be approved. All of our trainings will get approved. And so they represent a plethora of training that we have not centralized. And so it'll be really exciting in 2025 to see some of those and make some really good educated decisions based off of data. So I'm excited to see that. And I'm done going off script, Megan.
No, by all means. There's the way we've finished the script, so we're in the off script section of the meeting. Are any of these like standing out as things that either you feel like are affirming and you see the need and regardless of where you are in the state, or things that you're like, oh, I feel like, maybe I have an idea on how this group might or childcare licensing might be able to support. Amanda, I feel like I keep putting you on the spot, but I'm gonna do it again and just see, given how much the school district stuff came up, I'm curious if there's anything you would want to share.
Well, I'll share with this group. We've got some follow-up conversations scheduled between me and Melissa and Derek and their team. They got back from this and reached out right away to say, hey, we might have some new ideas. I think that something that stands out to me is that a lot of the time I mean, every community is different, right? But in a lot of communities, we have school districts who understand that there is a shortage of childcare and want to be part of the solution, but they're not really sure where to begin. And I think there's a lot of technical pieces to that, but I think that as a system, we've gotten a lot stronger in recent years at understanding the places that we can refer them to for support. So, for example, it's now very consistent when a school district reaches out to me to say, hey, we're interested in this childcare thing. I'm able to say, that's fantastic. We want to make sure that you're connecting with your local childcare licensing specialist, and we want to make sure that you're connecting with Childcare Aware of Kansas's community outreach and engagement team, because those are really the experts at being able to help a community understand the existing landscape of what's available and think through all of the options to partner. So that's something that's more organized now than it was several years ago, but I certainly think that it's an area where we can keep improving. And I also see that Melissa has her hand up, so I don't know if that's in response to something I just said.
Amanda, go ahead, Melissa, you go ahead.
Amanda, I was just going to say, I thought that was one of my most positive takeaways from the meeting the other day. One second, buddy. Oh, thank you. But I thought that was one of the most positive things was that we actually had a school district administrator there. I think it was the principal at Wamego. But that was really refreshing because I know just as a family provider that being asked to be at the table with those school districts was so meaningful to me. And they really took into account like what I was saying. And like even those kindergarten teachers, they were like, well, can you tell us like, how do you deal with this? How do you deal with these services? And those are questions that they don't always get an answer from because they typically don't have a family child care provider willing to sit at the table. And so I was really inspired to see that the Wamego school district had somebody there and he was asking valid questions and really wanted to know and was trying to understand how they could help. And then the other side of that is on the Spanish speaking side of things. There are like I've had a few providers in Manhattan that reach out and they are asking for support with an issue or something. And I can't help them unless my husband's home to interpret for me a little bit, just because he can do that. So it would be nice to find some of those dual language, maybe family childcare providers even, or center providers that were willing to step up in some of those mentorship roles as we continue to go through just to help those providers with that peer support.
That's a great idea, Melissa. And we are, as KDHE, is also recognizing the need, and we've been really expanded our equity programs within KDHE that childcare licensing is going to be moving forward with a dedicated staff that will that part of their position description will be to be bilingual. And so we're recognizing that at a program level too. So Dana, your hand's up.
Yeah, I wanted to chime in on the school districts and childcare. In Northwest Kansas, we've had lots of experiences where school districts have chosen to get involved in childcare. And kind of to mirror what Amanda already said, it seems like those partnerships are most successful when they do reach out to childcare resources, whether that is obviously it has to be KDHE, childcare aware, but also we, especially if I'm involved, that we make sure there is that connection with local providers because I kind of like the idea that childcare providers are most certainly in the business of kindergarten readiness. So if, I would like to see that big long continuum, but from my chair, school districts and childcare can be very successful as long as we make sure that they have those supports that they are maybe not aware of, that aren't things that they're looking at in the traditional K-12 area. So yeah, it's interesting to me that that was brought up, and I'm glad that there were school districts there representing their side of that, and happy that we're starting that conversation. So yeah, that was nice. The other thing that we see, I also hear parroted in Northwest Kansas, the hard part about finding substitute providers. And Melissa, you hit it on the nose. It's really hard to find, like, use a subservice if you're a home provider. So through my organization, we help those home providers in that process. So it's interesting. I'm not really surprised that that was an issue in the other, north central part of the state as well.
Dana, do you think there's something that you're doing in Northwest Kansas to address that issue that could be like further explored in other areas? So I think, like you said, it's a common issue.
For the subs?
Yeah.
Yeah, most certainly. So what we have done, and this is through funding through the Shared Services Hub with Child Care Aware, we also partner with Robin, to help to utilize her service for centers. But once again, that's not a good fit for home providers. So what we do is we offer, say you're a home provider and you're not comfortable with a stranger coming in and subbing in your own home. So what we'll do is we'll go to the provider and say, who do you feel comfortable having in your home? Maybe that is your next door neighbor or your mother-in-law or your sister-in-law. So we encourage the provider to find that person who they're comfortable with. Then through our grant funding, we pay for all the costs associated with that individual becoming a sub. We pay for their Casito classes, their first aid CPR training. So that is not a hindrance to that person becoming a sub, because quite honestly, it's a financial obligation to become a sub. So that way we're allowing our home providers to grow their own sub. And I think the key there is finding the person that they are comfortable with being in their home, and then helping that person get those training requirements that they need, and checking off all those things that needs to happen for them to be a sub. And we're hoping that holistically, if Debbie in her center has, we've paid and she's got a new sub, that maybe Debbie will tell her friend Angela, hey, you can really trust my sub so-and-so. And then we might be able to kind of spark that at the grassroots level. So that's one of the things we're doing in Northwest Kansas, specifically for home providers in terms of subs.
Thank you, Dana. Melissa, I saw your hand go up.
I was going to say the other thing, Dana, with you being in Northwest Kansas, one thing that I do here is I partner with K-State a lot and just go to the early ed department and reach out to those department heads and see if they have incoming freshmen or even sophomores that are interested in the early childhood field or education in general. And I think we have so many universities across the state that offer different education programs, whether it's Emporia State or there's K-State, there's Fort Hays, there's all those. And a lot of them will connect you with students. And yeah, you might only get them for 3 or 4 years, but that's 3 or 4 years of a sub that you could use. And I honestly have gotten a lot of my subs that way. And then also partnering with the high school FACS programs. If you're just needing an extra set of hands, if they're 16, they can come in and help you. That's me personally, that's not somebody I'm going to leave with my kids, but licensing standards, if it's a couple hours, you're okay with that. So that would be another thing to really try to almost like get that education out. Hey, get us all working together basically. But a lot of those students are just looking for, part-time jobs, but they need part-time jobs that don't have a consistent schedule. So those oftentimes are better for me. And some of them, maybe need observations. And that's another way that it helps them out too, is they can come in and do their observations as well. So just an option on that sub pool stuff. But yeah, the one with Robin, it's a great service, but the thing is it is just financially not in the business realm a good idea for family child care providers to use, because it's not financially beneficial for us in that way.
Melissa, you spurred my memory. So in Cloud County Community College, they've got an early childhood program.
Yes.
They require their students to sub and do that sort of work. So we're partnering with them to pay for the training for those kids, those students, to become subs, and then therefore they can help sub in the local child care facilities there in the Concordia area. And I know here in Hayes, Fort Hayes really relies heavily on students for employees and subs. So yeah, you're exactly right with that.
Definitely something that we will tug on as a thread at the next provider engagement or roundtable. I'm renaming it, Megan. Just renamed it. Yeah, no, it's the roundtable.
I think that's also Melissa, you mentioned kind of the awareness of how to do this, and I think Dana, I'm just thinking if there's a way to say, hey, we understand. I mean, I think there's barriers in general with substitute care. I know I've had conversations with Robin if they exist in centers as well, but here's how a provider actually did this in your community, and a testimony from the provider of yeah, it allowed me to actually take a break or take a day off. And I felt like I had somebody in my home that I felt comfortable with. I think that I could see that as something this group could help kind of inform of how do we get that awareness out. And, I think the more providers hear from another person that's doing this and it's helping them and it's working for them, that hopefully would increase access.
Exactly. Good conversation.
Okay, are there any other reflections on Abilene? I'm going to talk a little bit about our upcoming ones. I will say, while people are thinking, if you have any other final thoughts, so we are working on kind of pulling all of these responses together into a visual that we can share back with attendees from Abilene, and we'll do that with each of these. And then we don't want this to be a session where people came and had a bunch of great ideas and then don't ever hear anything about that again. And so if there are things that end up we can provide more information on, or we say, hey, this idea actually sparked, XYZ resource or things, we want to kind of continue that conversation with the attendees. But we're also exploring the idea of creating kind of a little bit of a regional childcare profile, so we can start to really understand what is different about North Central Kansas versus Southeast Kansas and their childcare needs. One of the original intents of these regional roundtables was to help KDHE and their team understand, we hear all the time, there's a childcare crisis. And yes, of course, there are major needs in childcare, but that may look really different in one side of the state than the other. And so all of this is designed to kind of help us, all of us, understand at a regional level, what's working well and what's not. So more to come in terms of kind of a product out of this. And we'll continue to do that with each of these, and we'll give you access too. So if you're in the region and feel like your organization can play a role, this is certainly not just state-led solutions. Okay. Oh gosh, sorry, I missed a slide. I don't think there's anything super new on here. I apologize for that. Yep, increase, I think we heard the grants. The awareness of the employer tax benefits for childcare is something that we've heard quite a few times, of just continuing to spread that that's an existing resource and how to apply for it. I'm sorry, Melissa, is there anything you want to share on this slide? I apologize for missing it.
No, I think honestly, we summed up what we were discussing between the
I agree.
United We report and this. So this, I feel like we've already rehashed it. So yeah, I
Perfect.
think yeah, it's
Okay.
good to move forward.
Dana, I saw is your hand up from your previous comment, or do you have another comment? No, might be that
I'm
Zoom,
good.
might be that Zoom phantom again. Okay. So we just finalized a date for our next roundtable. We decided is going to be in Northeast Kansas, particularly given that that's around the start of the legislative session, and we have quite a few new policymakers across Kansas. We really wanted to make sure that they felt looped in while they're in Topeka to just learn more about kind of what's happening in childcare in general and just build some of those relationships. So that will be held the evening of January 23rd at the Shawnee County Health Department. We will have a save the date for that with a registration link very soon. So we'll send that out with our notes and would appreciate any SIT members that can come. Just if you could send me an email or send me a message if you plan to attend, that would be great, just so we kind of know who's going to be represented from the SIT. And then please help us promote it. I think, like we said, this is we had a great turnout in the first one, and I would think that maybe the Northeast might be a little bit bigger given population. But we need your help in helping get the word out, particularly to those family childcare providers and families with young children in the area. And then I think I saw Mandy pop in here. Mandy and her team at Child Start will be hosting us in March in Wichita for the South Central Regional Roundtable. So again, we will save the dates with registrations out for both of those dates so that people can get it on their calendars. And then we're still kind of figuring out what the locations and dates will be for the Northwest, Southwest, and Southeast, but those will all happen a little bit later in 2025. So stay tuned. So
And we pivoted just because we had mentioned earlier that maybe we would be in Wichita in January, but just to acknowledge that we did pivot and we did move to Topeka, and that was we did that with purpose because we really wanted to in January, what starts in Kansas, our opening of our session, which is just a good time to have conversation about a topic that matters to just about everybody in our state is impacted by childcare, and we will be extending invitations to our legislative body to participate also. So really, again, we said we wanted to be bold and transparent in this roundtable process, and that includes particularly with the start of our legislative session, including our legislative voice at the table to make sure that they're being heard and that they have an opportunity to hear you all locally. And of course, that we extended that in Abilene. But when you have an audience that is centrally located, maybe there's more opportunity to join. So really excited about that process.
And I just have to give kudos to Derek and Melissa and her team. Derek sent a fantastic email out kind of sharing this idea and inviting policymakers to these events, and got a highly complimentary email back from one of them, just giving major kudos to KDHE for opening up these conversations to the public. And I believe he said something along the lines of, like, in all my years as a policymaker, this is one of the best things I've ever seen a state agency do. So it was a very high compliment, and I think well deserved, but also really nice to see. I think, we've only done one. We'll see how the others go, but I think it felt really good to hear the affirmation, both from people in the local communities as well as on the state level, of saying, like, these are conversations that really need to be happening, and they need to be happening now. So thank you for creating the space for them.
Can we share those dates if we know people in those areas and just tell them the time is to be determined?
Yeah, absolutely. And actually the time is set. So they're 6:30 to 8 p.m. I think I'm going to have the flyers for the save the dates this week. So we'll send the flyers out when we send the notes. So actually you should be able to send that, and they can there will be a little link and a little QR code that they can register. It's not required, like people certainly can walk in, but just to give us a kind of a sense of how many chairs we need in the room would be great. And then also when people register, we do ask the questions that you saw ahead of time. And also if you have anybody that for whatever reason can't make that time, like they can still go ahead and fill out those surveys, or my email is on the flyers. Like we fully understand people may not be able to physically be in the room and want to make sure that they have space to share their input. So as you're talking to people, just please like spread the word that like if we would love for them to be in the room, if that's not possible, their feedback is still equally important and we want to hear it.
And we are very old school in these sessions. We take, we have sticky notes, we bring pens, we have pencils. Everything is captured that way. We put things on just, big poster board. And, but it's really, it's a conversation and really empowered when people were making comments to come up and share in the larger group. We might have to alter how we conducted ourselves in Abilene, but really was so proud of how everybody was respectful and then asked questions and asked people to elaborate. And really, it ended up being one of my in 2024, one of my favorite engagements, computing engagements. So bar has been set really high for everybody who's went to Abilene and looking forward to the Topeka setting.
So we will be sending out a cancellation for the planned group meeting. I believe was scheduled for January 21st, but 21st, just because we will be doing the regional roundtable later that week. So we will not meet as a full group in January. We will do the Topeka roundtable that week instead, and then we'll come back together as a full group on February 18th to kind of debrief how things went into Topeka. If you have anything you want to share with the group, like if you have events or updates or anything like that, I know since we're not meeting as frequently, like it may be hard to share those things in the meeting. You can always send those to me for us to send out to the group. But yeah, we will come together again on February 18th. We'll get these notes out so that you can kind of sit with what we heard from Abilene, and we'll have more to share from Topeka the next time we come together. But if you see opportunities for this group, or even just for your, I feel like there were some really good ideas of like things we could be doing at the local level based on what we've heard. You just kind of keep Melissa and Derek and me and our teams updated on that. We really want to be able to show people as they come to these regional roundtables, like their comments are being heard and leading to change. So we want to be able to kind of close that loop with them so that they aren't left wondering. But thank you so much for the conversation today. Are there any final thoughts before we break?
I just wish everybody safe travels into the new year. I can't believe I like saying that as we get closer. 2025 feels a little bit more glamorous than 2024 for some reason. It feels lighter. So hopefully we will have some really good positivity moving into 2025. And thank you for your commitment. And as we just continue to move forward and turn the page on a new year.
Thank you all. Thanks for being here. Happy holidays.